Hello, I'm Dr. Dan Soular, family medicine physician and Vice President of Medical Affairs at Grand Itasca Clinic and Hospital in Grand Rapids. Though we continue to see a gradual rise in the number of cases of COVID-19 in Itasca County, we know that the sacrifice made by our community in staying home for the last couple of months has paid off. We were able to prepare our staff, make necessary adjustments to our facility, and stockpile personal protective equipment so that we can confidently care for COVID-19 patients, as well as other patients needing medical care. Thank you for that. Since the start of the pandemic, we learned a lot about this disease, though we still have a long way to go. At this time, Grand Itasca is offering COVID-19 testing for all symptomatic patients. Anyone who has symptoms common with COVID-19, including shortness of breath, fever of 100 degrees or more, new cough, or new aches or pain, should call Grand Itasca and request a telephone visit with a provider, who will provide instructions for curbside testing. We will also continue to offer testing for congregate living settings, such as nursing homes and assisted living facilities. We're also working with local businesses to fit test their staff for personal protective equipment and for other medical service providers, such as dentists. We're able to test their patients prior to them performing procedures to keep themselves and their staff safe. Nationally and locally, in some cases, there's a lot of research being done on treatment options as well as vaccinations for COVID-19. At this time, there is no proven treatment, and a vaccination is not likely until at least 2021. Antibody testing, or a blood test that identifies if your immune system has been exposed to and developed COVID-19 antibodies, continues to be available at Grand Itasca. But without a lot of evidence about what the results offer us, we have not had much demand for the test. While cases of and deaths caused by COVID-19 continue to go up in Itasca County, we are also seeing businesses and people resuming many normal activities. This includes many services at Grand Itasca as well. We continue to offer walk-in care and are seeing more and more patients for in-person appointments in our clinic and for rehab services. Our virtual care options, e-visits, telephone visits, and video visits also continue to be popular and have been well received by most patients. Our elective surgeries are back on the books, as are most of our diagnostic screenings, such as mammograms. Care should not be delayed. Please know that we're taking every precaution possible to ensure our patients and staff are safe while in our facility. While getting back to normal is a good thing for our economy and our mental health, I caution you to remain diligent about your role in reducing the spread of the disease. This includes washing hands with soap and water or hand sanitizer when soap and water is not available. Use an alcohol-based hand sanitizer with at least 60% alcohol and rub your hands together until dry. It's recommended that this should take approximately 20 seconds. Also, when you are out in public, particularly indoors where you cannot remain 6 feet away from others, please wear a mask. It's important to wear the mask above your nose and below your chin and use the ties or elastic bands to secure around your head or behind your ears. We also recommend that you hand sanitize after you placed your mask on. This is our new normal, or at least our normal for a while. While masks do not offer the wearer protection, they do protect others. By wearing a mask, you are showing those around you that you care about their health. Grand Itasca is committed to continuing to do what's right for our patients and community. We ask you to do the same to keep your friends, family, and neighbors safe as well. We're in this together, and we'll get through this together.